Let's discuss the surgical protocol for socket grafting with flap reflection. A vertical incision is performed approximately 5 millimeters from the extracted tooth. This vertical incision should not extend more than 3 millimeters past the mucogingival junction. Elevate a full thickness flap, but do not exceed the mucogingival junction by more than 3 millimeters into the mucosa. However, if there is an extended defect, then expose as much as needed to see the entire defect, and then go back to 3 millimeters. Note that the entire defect must be visualized prior to augmenting. Once flap elevation is complete, grasp the mesial corner of the flap and stretch. Then the middle part of the flap and stretch, followed by the distal part of the flap and stretch. The syringe contains a saline chamber, the graft powder, shaft, 2 pistons, the indicator line, and a cap. The shaft is placed in the palm of the hand, the other finger at the top of the cap, and the shaft is advanced forward until the first piston reaches the indicator line. Remove the cap with a twisting and pulling motion and place the shaft between the pointer and middle fingers. Once proper debridement is completed and the site is prepared for grafting, activate 3D Bond Plus and eject the contents of the syringe into the socket. Immediately, a sterile unfolded dry gauze is placed over the cement and pressed firmly with the finger from the buccal and the crestal direction for about 3 seconds. It's extremely important that the 3D Bond Plus cement is well compacted in all 3-dimensional aspects, including the cervical and apex zone. After pressing with the finger, use the periosteal elevator in order to continue with the compaction of the graft for an additional few seconds. Again, from the buccal and crestal directions. Once compaction of the graft is done, remove the gauze and proceed with soft tissue closure by stretching the mesial corner and securing it with the suture. Next, the distal corner is secured, then the middle part, followed by the additional sutures as needed. The vertical incision should be sutured last. It is important to remember not to use fast, dissolvable sutures such as plain or chromic gut, and, of course, do not use any removable appliance over the graft.